So I'm going to talk about the practical aspect of using evidence-based modalities, and I'll tell you how it even came about. My own journey with pain. I was a healthy individual, and one day I found myself waking up in the hospital. I had been victim of a violent crime, and there was surgery that had to be performed on me to keep me alive. So I went from somebody who could do a lot, who was very active all day and athletic, to someone who couldn't move and needed help to go even to the bathroom. So that's where my post-op journey and the love-hate relationship with pain started. Over the course of time, as I learned to empower myself, I found myself changing from an engineer to a healthcare professional and very much gravitated towards pain management. The tips I'm going to share is from the pre and post-op surgery class that I teach at UCSF because we see a lot of improvement in the outcomes and just the satisfaction of people when they feel prepared, like the way Alicia talked about it. And we try to figure out a way to make that knowledge easily accessible to everybody. So we worked on building a solution, an online solution, an app that can make all of this information available and accessible to all as the first step in that direction. So the first question is, does preparing for surgery really help? If not, then why waste time, right? So there have been a lot of studies done, over 200 studies done on 8,000 patients that show that it does lead to reduction in pain and fewer complications. And one thing to note is that when we look at pain management, pain comes as a symptom cluster, which means if a person has pain, they're likely to get all other issues. They're going to have fatigue, they're going to have depression, they're going to have anxiety, and they're all going to interplay with each other. And this also is impacted by their treatment as well as their environment. So when we look at how we handle pain, we need to think about all these different aspects and addressing all of them at the same time. So in terms of where we start, the first step is actually to make a plan. And part of that is knowing what to expect with your treatment, what to expect pre, intra, and post, and even small things like who's going to drop me there, or what am I going to eat, do I have time off, results in a huge reduction in anxiety if you know what to expect and you're prepared for it. I have seen that I've had to give personally 50% less anxiety medications and pain medications when my patients are prepared for the surgery. They know what to expect because anxiety and pain correlate with one another. The other thing is, at some point, given that you're going through a surgery, it's going to be debilitating and impact us for some time. You're going to feel crappy. So it's really important to have a I feel crappy plan. So what does that mean for you? What can you do to feel good or to just get through it? And then it's easier to go through that checklist of I can handle by doing X, Y, Z. I had a couple of friends that I had on my crappy plan list. So I would SOS them saying, I'm going to call you and rant because that's what I need right now. And a pain management plan. So that is going from least invasive to most invasive. What are the options you want to consider, and then having that figured out for you. So when we talk about pain, one thing also I want us to think about is not to shy away from pain medications, because if this is a short-term pain, that is post-op, pre-op, so if we are in pain, as we saw in the other picture, it's going to relate to other issues. If you can't sleep well, you cannot get your physical therapy, you feel down, it's going to lead to a longer recovery time. So let's think about if we need to use pain medications and think of what are the other ways that we can handle pain when it is before it's starting or just when it is starting. So that's when you can look at other evidence-based options. Also look at side effect management, because lot of times when it's pain or it's surgery, it's going to result in other issues that we have, like constipation, or the digestive system is still waking up, insomnia, all kinds of other issues. And there are a lot of ways to use integrative medicine modalities to address that. So here are some options. I won't read through the entire list, but I think Alicia touched on a lot of those with the visual therapy that she talked about, as well as using exercise, and you talked about the planning for it. And there are a lot of all these modalities. I have personally tried them, and I've had a lot of our patients try them, and they're very effective. If you haven't heard of laughter yoga, you might want to check it out. So next, I want to talk from a tech perspective. So what we wanted to do was, given that there are, when it comes to integrative medicine,